Acute pancreatitis in a patient with COVID-19 pneumonia, a case report. Although SARS-CoV-2 is primarily a respiratory pathogen, the virus has been shown to have multi-organ tropism and extrapulmonary manifestations are increasingly being described. Angiotensin-converting enzyme 2 is the SARS-CoV receptor. This enzyme is highly expressed in the pancreas, thus rendering the organ a potential coronaviral target. While gallstones and alcohol are the most common causes of pancreatitis, 10% of cases are infectious in origin. I present the case of a 64-year-old gentleman whose history was significant only for hypertension, who was admitted to our intensive care unit with severe COVID-19 pneumonia. He required intubation and mechanical ventilation, and his therapy while in ICU included ceftriaxone, corticosteroids, and remdesivir. On day 18 of his admission, an unexplained rise in liver enzymes prompted CT imaging, which showed changes consistent with acute pancreatitis. Serum amylase was found to be 1,704 units per litre, and thus the patient fulfilled the Atlanta criteria for diagnosis of acute pancreatitis. The patient had a prolonged ICU course where he received supportive care, but ultimately made a good recovery. We propose that our patient's pancreatitis was related to SARS-CoV-2 infection, either directly or as a result of the medication used in its treatment. The multisystem involvement is due to the widespread distribution of the angiotensin-converting enzyme 2 receptor. Viral binding and entry into the cell and viral replication are postulated to result in pancreatic injury via a direct cytopathic effect. An exaggerated immune response or SIRS response, microvascular injury, thrombosis or ischemia are postulated indirect mechanisms of cell injury due to SARS-CoV-2 infection. Drug-related pancreatitis accounts for approximately 5% of cases, and drugs used in the treatment of COVID-19 pneumonia have been implicated in the pathogenesis of pancreatitis, and therefore we cannot outrule medications as a possible cause of our patient's pancreatitis. This case describes acute pancreatitis in the setting of severe SARS-CoV-2 infection and its treatment, supporting existing reports in the literature that acute pancreatitis is an extrapulmonary manifestation of COVID-19 disease.